How can you legally get the weight loss drugs 80% below the major drug company prices? I'm Brent Wilsey with Wilsey Asset Management. There are federal laws that make it legal for compounding pharmacies to make copies of drugs that the Food and Drug Administration, known as the FDA, says are in a shortage situation. The weight loss drugs have been in a major short supply for the last year or two, and because of the FDA rules, these compounding pharmacies can now create and distribute the same type of drug. There are so many startup companies that are doing this now. You have many different options to choose from. Now, the lowest price one I found had a monthly cost of only $199, but there is a required annual upfront payment. But compare this to these prices of the other brand name drugs, about $1,349. A major problem for these compounding pharmacies is the FDA can close this market when they feel that the drug is no longer in short supply. The companies have said they can tweak the formula and still get a similar result. That would scare me just a little bit, because if I was taking these drugs, I'd be concerned. But the FDA also does warn that these drugs, these compounding drugs, may not have the same safety, quality, and effects as the brand name drugs. We have said many times before, we do believe these will be problems with these drugs and potential side effects perhaps down the road. With that said, I know the drug company spent billions and billions of dollars on research and development, and it seems wrong to me that these other companies can come in and piggyback on what that drug company developed. Now, some may think it's a good thing because the price of drugs are just way too high, but think about this. If there's no protection on a drug that you develop, companies would likely stop spending billions of dollars to develop new drugs, and drug advancement would probably come to a halt. Stay in the investment world by subscribing to YouTube channel and weekly newsletter for the latest economic news, expert analysis, and market insights.